The state looked at what's been going on with COVID and with police violence and just the mental health need in the community, and said that there's really a need to scale these mobile crisis programs.
The current demand for mental health care is high.
Unfortunately, for some of us, we are not always able to get the care we need when we need it.
In tonight's special report, Sylvia Perez takes a look at what one community group is doing to make mental health care available on the spot.
When we see a person in distress, our first reaction, call 911.
911, what's the address of your emergency?
Depending on the situation, you actually may not want to call the police first.
What can we do to support you?
Trilogy is a nonprofit behavioral health care organization in Rogers Park. Caitlin Smeal is one of the crisis counselors who is part of Trilogy's new mobile response team. She recently helped someone who called Trilogy's hotline while in mental distress. Caitlin is now on her way for a follow-up visit with that person.
When I originally took this position, I was more so thinking of a crisis that someone is suicidal, someone is homicidal, but after working with a lot of folks and a lot of these calls, there's a lot of different things that constitute a crisis.
After months of planning, Trilogy began rolling out its first response alternative crisis team in January. Since then, it's received more than 230 calls from people looking for mental help, either for themselves or a family member. They've been able to help about half over the phone and the other half by responding to their call for help in person.
We have been getting some referrals from the police departments.
As Caitlin said, there are a lot of different things that constitute a crisis. These days, many of those things have to do with access to services.
With COVID, all these benefit offices have been closed, and there's been these virtual appointments, and some people don't have phones. They don't know how to use technology.
Historically, the only type of on-demand service like this is calling 911 or going to a hospital. And so both of those have, downsides, different downsides that, make it not ideal.
7 days a week from 7 to 7.
When they're not responding to a call, Trilogy's mobile crisis response team is still hitting the streets, this time to get the word out about the program. They are currently available 7 days a week from 7 a.m. to 7 p.m. By the end of the summer, they plan to be available 24/7.
This is something sorely needed throughout the city.
Maria Haddon is the alderwoman for Chicago's 49th Ward. Right now, Trilogy's team primarily covers the north side neighborhoods in that area, along with Evanston and Skokie.
Checking to see how you're doing.
Haddon says her ward ranks about 5th in the city when it comes to calls for help with mental health.
It gives people options to be able to care for their neighbors, to get people services in the appropriate manner. I've used the line, and it's really nice to you quickly get to talk to a real person, right, who is trained to ask you questions to help you assess the situation, and then they make a determination.
Trilogy is one of about 10 agencies in the Chicago area that received funding from the Illinois Department of Human Services to provide mobile crisis response teams. The number to reach Trilogy's team is 800-FACT-400. That's 800-FACT-400. Sylvia Perez, Fox 32, Chicago.